of head of femur. This is going to be from the obturator, but this is not going to be enough. Now, moving to the muscles of the gluteal region, we have a very big muscle, and that muscle we call it the gluteus maximus, because this is the biggest one. It takes its origin posterior to the posterior gluteal line, and it takes its origin from part of the iliac crest, from the thoracolumbar fascia, from the sacrum, goes all the way. It gives partly some of the muscles will attach to the gluteal tuberosity, and some of them will blend with the iliotibial tract. It's a very huge muscle, as you can see. It gives you part to the gluteal tuberosity, and some of it will blend with the iliotibial tract. We have a very important tract, a fibrous connective tissue that comes all the way from the ilium all the way to the tibia. This is a very important tract, and the gluteus maximus is going to attach to it. All right, and also we have another muscle, we're going to talk about it later on, or we can say it now, which is the tensor fascia lata. Tensor fascia lata is a hip abductor, and it blends also with the iliotibial tract. And this is the gluteus maximus muscle. Now, if we move on to see what we have the gluteus maximus and medius and minimus and tensor fascia lata. Those muscles are in your gluteal region. The biggest one, maximus, is going to be hip extension, and the rest of them, the medius, minimus, and also we have tensor fascia lata, that will help you to do abduction. All right, so if you go abduction, it's going to be the medius minimus and tensor fascia lata. It can also help you in internal rotation. So this picture is for the last three ones. Maximus, you don't need to remember it. Just touch your or hold it with your hand now and do hip extension. You will know that this muscle does hip extension and external rotation. It's different than the others. However, the others, you need to remember this picture. It helps you to do hip abduction and internal rotation. Now, where are these muscles coming from? We talked about the maximus, and we know from where it's coming until where it's going. But the medius and minimus, you need to know that we already talked about the origin of them, the gluteal surface and between which line. And then I told you guys, all people who want to work on external rotation and abduction and stuff like that needs to go to the greater trochanter. All right, and also we will talk about a small, very small muscles here, the external rotators. They will also go to the greater trochanter. So basically, here you have the greater trochanter. Remember that the gluteal region, the small muscles for external rotators, everything in the posterior thigh we're going to talk about now. If we want to do abduction and external rotation, they are going to insert into the greater trochanter. Medius minimus, greater trochanter. The small hip, small muscles for hip external rotation or lateral rotation, also greater trochanter. Okay, so medius minimus, we know everything about them coming from where. Where do they go? Greater trochanter. Maximus, talked about it. What about the gluteal, the blood supply and nerves? You guys, if you look at the gluteus medius minimus, you will find that they are above, okay, superior. So from here, you will get nerves and vessels to go to those guys. We call it superior gluteal nerves. So they are supplied by superior. However, the gluteus maximus is going to have from the inferior alone. So remember that, and it will make sense now because I will tell you about the S-pen structures. You guys can come back to this video when you hear about the S-pen structure. Come back to this part of the video again to make sense. The piriformis, guys, above that you will have structure called S. That S is the superior gluteal nerve and vessels. So they will come out from the pelvis through the greater sciatic foramen above the piriformis to supply the gluteus medius and minimus. And below that you have the spin. The only thing I want you to know now is the inferior gluteal nerve and vessels. It goes to the gluteus maximus. All right, let's move on and then we continue the story. Now remember I told you, we talked about the gluteus maximus, medius and minimus, and now I want you to think about the external rotators, deep region. The external rotators, guys, we have the piriformis, which is the piriform in shape. The piriformis, guys, comes out from the sacrum. From the ventral surface of the sacrum, it has a very famous appearance. It goes all the way to the greater trochanter of the femur because it's going to do external rotation. Now, what are the other muscles that do external rotation? We have two twin structures. Gemellus, you guys, in Latin means twin. We have superior one, inferior one. Superior gemellus, inferior gemellus. Okay, gemellus superior and inferior. Those muscles are coming from your ischial bone, and they will go all the way to get attached to the greater trochanter. Okay, so you have the gemellus superior, inferior. Now, what separates them is the tendon of obturator internus. So the obturator internus comes out. If this is the obturator foramen and it's sealed off by obturator membrane, the muscle that comes out from internal membrane, we call it obturator internus. The muscle that comes out from the external, we call it obturator externus. So in here, in the small muscles in the gluteal region, the piriformis is a big boss. It's above. It's a very important landmark for the SS pen mnemonic. And then we have the rest of the guys down here together. So there is a small separation between them. This is important for your practical. So you have twin muscles, gemellus superior and inferior, and so what separates them is the obturator internus. And this is a gemellus superior and inferior. And that is the big boss up. And we have here the quadrate muscle appearance, which is the quadratus femoris. It's square in shape. Okay, so this is a square muscle. It goes to the intertrochanteric crest. So everything today we said it's going to the greater trochanter. All right, so those guys are going to the greater trochanter. And if they want to work on your external rotation, definitely they are coming from the seat bone, the ischial bone. Okay, so those guys are coming from the ischium and they are going to the greater trochanter. So we said that the gemelli, the blue muscles, are basically twin, and they are gemellus superior and inferior, and this is what we mean by gemellus in Latin. And because they are very cute, they don't have separate innervation, they will also become bigger. We have those guys where they are going to take innervation from the surrounding people. Remember teres major and minor? We have the same story here, and we're going to talk about it as we proceed. So if you guys look at this very nice diagram, you will see that the piriformis is basically coming from the ventral aspect of the sacrum around the sacral foramina and goes to the greater trochanter. And then you have three guys, two twins, and one separates them coming from the inner side of the obturator membrane, which is the gemellus superior and inferior, and they are coming from the ischial bone to the greater trochanter. And then you have the quadratus femoris, also from the ischial bone, but to the iliac crest. This is a very nice diagram to show the origin and insertion. Now, what do they do? Mainly, the most important function is the external rotation. However, they can also do abduction and flexed hip. You guys make sure to know the function. Make sure to know what does external rotation mean. It's very good if you go to your instructor and you can just revise the movement of your anything, upper limb, lower limb, because it's very good if you see it in person, not in picture. But this is external rotation of the hip. If you have flexed hip and knee, and the story is different. If you have extended, it looks different. You need to discuss how the movement is in reality, other than seeing pictures. If you are flexing, the leg will go inside. However, this is external rotation of the hip, okay? Because you need to touch your hip and see what's happening in your hip joint. And we're talking about the hip joint here. So this is external rotation. So what are these muscles doing? Basically, they are doing external rotation. Also, we have obturator externus, but we don't have it shown in those diagrams. And this is different also because this one is near to the obturator area. That's why it's supplied by obturator nerve. So the obturator nerve is actually a nerve to the adductor region. We're going to talk about this nerve later on. Now I want you to understand what is the innervation for those guys. It's very quite simple. Now piriformis is a big boss, so it has its own nerve coming from the anterior rami of S1 and S2. So the nerve supply to the piriformis is anterior ramus of S1, S2. Sometimes they call it nerve to piriformis. This is out of our story. But we have a story between these four guys. We have a very cute twin here, all right? If you look at them, let's get back to this. If you look at them, guys, you will have the gemellus superior, gemellus inferior. Now, if I told you that we have a nerve to obturator internus and a nerve to quadratus femoris, so from where you think the gemelli will get innervation. We said they are beggars, they don't have nerves, so they will borrow innervation from the neighboring structure. So then the gemellus inferior is going to take innervation from the nerve to quadratus femoris, and the gemellus superior is going to borrow innervation from the nerve to obturator internus. All right, and it makes sense. If you don't recall it from the practical point of view, you can also remember it by the F. Nerve to quadratus femoris, it gives to gemellus inferior. And the obturator internus gives you to superior gemellus. Okay? By that, everyone knows the innervation for all the muscles we have. Now let's go ahead and see the muscles. If you guys see something that covers everything, this is gluteus maximus. If you reflect it and look, you will find gluteus medius. Okay? After that, you have a big boss. That is my reference, the piriformis muscle that goes to the greater trochanter. And then you have two cutie girls, gemelli, and one muscle separating them. So this is gemellus superior, this is gemellus inferior, and what separates them is the obturator internus. And I have a square-shaped muscle here, which is what we call the quadratus femoris muscle, and that goes to the intertrochantary crest. These are the small muscles, and this is the practical note. Now we are ready to know what are the S-spin pin. Now, because we know that the superior gluteal nerve and vessel supply the gluteus medius minimus, and the inferior supplies the maximus, and we know everything else, let's go ahead and see what is the mnemonic. The mnemonic, guys, is that the greater sciatic foramen, it gives an exit to the S spin pin. And the so what does S? The S is the superior gluteal nerve and vessels. What is spin? Spin is gonna be your sciatic nerve. P is the posterior cutaneous nerve of the thigh. I is the inferior gluteal nerve. N is nerve to obturator internus. Now what about it's nerve to quadratus femoris, and I will tell you why. This is not this, it will make sense now. This is nerve to quadratus femoris. Now what about the pin structure? The pin structures are the structures that will come out of the greater sciatic foramen, and it will enter back through the lesser sciatic foramen. So what are these? These are the pudendal nerve, the internal pudendal vessels, and the nerve to obturator internus. Now, today, guys, we have two nerve to. We have nerve to quadratus femoris and nerve to obturator internus. It makes sense, you guys, that the one that wants to enter back is the obturator internus, because the obturator internus is a deep muscle, and this is in the obturator area, the genital area, and people coming from outside and entering back from here to reach the perineum is going to be the pudendal. Pudendal in Latin means shame area, and internal pudendal vessel. So those guys, they will enter back, pin structure, and the obturator internus is inside. However, the S spin, these are the people that will come out from the greater sciatic foramen, and they don't want to enter back. Why? Because they are either going to the gluteal region, or they want to continue the journey to the posterior thigh. So pin, the structures that come out and enter back, pudendal, internal pudendal, nerve to obturator internus. Now, what is the S spin? The superior gluteal nerve and vessels. Hello, great. We have here, all right, we have here the piriformis is going above the piriformis, the S. Below the piriformis, the spin. People coming out and entering back without showing up in the gluteal region, the pin. All right, and the pin will concern you in the reproductive module, not here. Now let's see the S spin. The S is the superior gluteal nerve and vessels, and they are going to supply medius and minimus. Below the piriformis, I have inferior gluteal nerve and vessels. They will go to the gluteus maximus. And then I have the first one is the sciatic. Sciatic nerve will go all the way to the thigh. And I have posterior cutaneous nerve of the thigh. It's a cutaneous nerve. You can see it here. If this is not, they mean by this inferior gluteal, I think they mean inferior gluteal. The posterior cutaneous nerve of the thigh is not shown in this diagram. Anyway, and then followed by the I inferior, and then the N, which is nerve to quadratus femoris, it's going to quadratus femoris muscle. Definitely, this is someone who wants to exit without entering back. This is why if you get confused like me, N and N, just remember that the spin is a structure that comes out without entering back. But if someone wants to enter back, which is the nerve to obturator internus, because this is a muscle that comes from the internal surface of obturator membrane, it's gonna definitely be the nerve to obturator internus. Now, can we see those structures? Of course. If you guys look at a posterior region, you can see the sacrum here. And you can see all the people we have deep here. You have the piriformis, your reference. You have the three muscles, and then you have the quadrate muscle, the gemellus superior, gemellus inferior, obturator internus in between. You have piriformis above. If you have a nerve coming out from above the piriformis, this is the S, superior gluteal nerve and vessels, and they go all the way to supply medius and minimus. If you see the piriformis here, guys, you see the superior gluteal vessel and nerve, they are going to medius and minimus. And then below the piriformis, you have the spin structure. The S is the sciatic nerve. The P is the posterior cutaneous nerve of the thigh. If you guys look below the piriformis, you have the spin, S sciatic, P posterior cutaneous nerve of the thigh. I is the inferior gluteal nerve and vessels. Usually you will find that those are going to the gluteus maximus. If you have a real cadaver in your dissection hole, you will see that the inferior gluteal nerve and vessel is going all the way, and it's attached to the reflected gluteus maximus. It means this is the inferior gluteal nerve and vessels. And the last one is basically the nerve to quadratus femoris. This one, it's very difficult to see for my own self. I've never seen this nicely in a cadaver, but probably this could be that nerve. It's very difficult you find it in cadavers, but if you find a nerve that reaches the quadratus femoris, this is going to be the nerve to quadratus femoris, which I don't have it here. All right, so this is the spin. The last thing is the pin. Luckily, we have here the pudendal nerve. And if you see a vessel, it's going to be internal pudendal vessel. And then also the nerve to obturator internus is very deep. You cannot see it from here. All right, so this is the S spin pin. These are the structures that are coming out from the greater sciatic foramen. And the S is above piriformis. The spin is below the piriformis without coming back. And the pin are the people that are going to come from the greater and to the lesser below the sacrospinous ligament, without you seeing them in the gluteal region or the thigh. Now, reaching to the nerves, of course, we talked about the nerves from that concerns us today. They are coming from the sacral plexus, and that was lumbar plexus. So we talked about the superior gluteal nerve, inferior gluteal nerve. The nerve root is above, and if you come to know that your sacral plexus is formed by starting from the sacral roots, and then you have your lumbar L4 and L5 joining your roots, you will find that the superior gluteal nerve is taking roots above the inferior. So you have from L4, L5, S1. However, the inferior gluteal is L5, S1, S2, and then piriformis S1, S2, and then you have the sciatic, you have the common peroneal or common fibular and tibial. They have two parts of them. And those why we have two, because remember we had divisions in the brachial plexus. The same thing we have it here for the sacral nerve. We have anterior division, and the anterior division will do your tibial part, and the posterior division will do your common peroneal or common fibular part. Together they will do the sciatic nerve, and once we get down, they will bifurcate down, and they will divide themselves into the fibular part and tibial part to continue the journey and take care of tibial structures and fibular structure. We're going to talk about that as we reach, and definitely you have the rest of the nerves. We already talked about them, and we know that the nerve to quadratus femoris also gives to the inferior gemellus, and the nerve that to obturator internus also gives to the superior gemellus. And we also talked about the structures that need to come out from the thigh. Now, from the posterior thigh, we have the hamstrings muscle. They are important for knee flexion, and we said that the people in the posterior thigh, they come from your seat bone, your ischial tuberosity, and then they attach themselves to the knee. the bone that is down. If they want to work on the knee joint, it means they need to go ahead and attach themselves to the leg bone, whether tibia or fibula. How will you remember the insertion? Remember, guys, when I told you the biceps in your upper limb was the only muscle that goes to the radial tuberosity. The same idea we have it here. The biceps femoris is the only muscle that goes to the head of fibula, and the rest of the muscles will go and attach themselves to the tibia. Okay, so you have the semimembranosus, semitendinosus. They go ahead and attach themselves to the tibia. And the biceps femoris, it's biceps because it has two heads, one head from the ischial tuberosity and another head from the linea aspera in the posterior aspect of the femur, and then they will go ahead to attach themselves to the biceps, to the fibula. Okay, so remember the biceps in the in your arm was to the radius I, biceps radius I, and the biceps femoris in your lower limbs is gonna go to the fibula I, and the rest of the muscles are going to the tibia. It also has I, but anyway, radius resembles fibula resembles radius in upper limb. So remember that the radius the biceps muscle goes to the small bone of forearm and the small bone of leg. Okay, that way will help you to know the insertion. Now, what do they muscles do, and why do we call them semimembranosus, semitendinosus? Semi means the semi. You guys know that semi means half. Membranosus because half of the muscle is membrane, and semi, the other one, tendinosus, because half of the muscle is a tendon. So if you guys look at the muscles in order, you will find a semimembranosus, a muscle that half of it is basically a membrane kind of tendon. This is the membrane of semimembranosus if we try to remove the muscle fibers. So that's why we call it semimembranosus. And this is a tendon. Half of the muscle is a tendon. This is something we don't usually see, that half, a long, very long tendon actually. So semimembranosus, semitendinosus, and biceps femoris. These two will go to the tibia, and the biceps goes to the head of fibula. The biceps femoris, I can see the ischial part, and if you cut it off, you will see that the other head coming from linea aspera. This is basically the line in the posterior thigh bone. This is the other head. So this is the long head, and this is the other head that comes from the fibula. Both of them will attach to the head of fibula. So these are the hamstrings. This is a nice summary for you guys. I just want you to know that all of these muscles are supplied by the tibial part of sciatic nerve, except the exception. Who was our exception? It was the biceps femoris. Remember, that was the only muscle that goes to the fibular head. The short head is going to take its innervation from the common fibular nerve. And it makes sense also because this is the muscle that goes to the fibular head. So remember that the one that goes to the fibula takes from the fibular nerve. And you guys know that the sciatic nerve has two parts. It has tibial part, and it has common fibular. So this one is going to, so that's why I told you guys, can you notice the relation between the insertion and innervation? I know the long head also get inserted into the fibular head. I was just trying to give you some hints to help you to know some specific information without memorization. Okay, so the short head, it takes from the common peroneal or common fibular part of sciatic nerve. The others will take their innervation from the tibial part. Okay. All right, so with that, we are done. Thank you guys for watching, and see you in the next videos.